Hello again, all you health-savvy viewers and future medical minds. Welcome back to Life of Medical, your go-to channel for exploring the amazing world of medical technology. Tonight, we're stepping into the realm of another diagnostic powerhouse, a machine that has truly transformed our ability to see inside the human body quickly and effectively, the computed tomography, CT device, often referred to as a CAT scan. Our journey today is titled Decoding the Donut, a deep dive into the computed tomography, CT, device and your CT scan. We'll unravel what it is, how it works its magic, and why it's such a critical tool in so many medical scenarios. Let's get scanning. What is a computed tomography, CT, device? First things first, what exactly is a computed tomography, CT, device? Imagine a very sophisticated X-ray machine, shaped like a large donut or ring, that doesn't just take one flat picture, but instead takes many X-ray images from different angles all around your body. A powerful computer then processes these multiple X-ray beams and their measurements to create cross-sectional images, or slices, of your bones, blood vessels, and soft tissues. Computed refers to this computerized processing, and tomography comes from the Greek words tomos, meaning slice, and graphein, meaning to write or record. So, a CT scanner essentially writes down a series of slices, allowing doctors to see intricate internal details with incredible clarity. This technology provides much more detailed information than plain X-rays, offering a non-invasive window into the human body for diagnostic purposes. How does a CT device work to create images? Now let's delve into how a CT device actually works to generate those detailed images. As you lie on a table that moves through the center of the donut-shaped scanner, known as the gantry, an X-ray source rotates around you. Directly opposite this X-ray source is a set of electronic X-ray detectors. As the X-ray tube spins, it emits a narrow beam of X-rays that passes through the section of your body being examined. Different tissues absorb different amounts of radiation. For instance, bone absorbs a lot, while soft tissues absorb less. The detectors on the other side measure the amount of radiation that makes it through the various tissues. This process is repeated rapidly from many different angles as the X-ray tube and detectors make a full 360-degree rotation. All this data is then sent to a specialized computer which uses complex algorithms to reconstruct it into detailed, two-dimensional cross-sectional images, which can then even be stacked to create 3D views. Where are CT devices typically found and used? You might be wondering, where are these essential CT devices typically located and utilized? CT scanners are a cornerstone of modern medical imaging and are most commonly found in the radiology departments of hospitals, from large university medical centers to smaller community hospitals. They are also prevalent in dedicated outpatient imaging centers and clinics. Due to their speed and diagnostic capabilities, they are particularly vital in emergency rooms and trauma centers, where quick and accurate assessment of injuries is critical. You'll also find them in cancer centers for diagnosis, staging, and monitoring treatment response, as well as in cardiovascular units for assessing blood vessels and heart conditions. Some specialized CT scanners are even used in orthopedic practices or for dental imaging, showcasing their versatility across various medical fields. Their widespread availability ensures that patients can often access this important diagnostic tool when needed. When is a CT scan typically recommended or performed? So, when do healthcare professionals typically recommend or perform a CT scan? A CT scan is often the imaging modality of choice in emergency situations because it's fast and can provide comprehensive information quickly. For example, it's frequently used to diagnose problems such as bone fractures, internal injuries, and bleeding, especially after trauma like a car accident. Doctors also use CT scans to pinpoint the location of tumors, infections, or blood clots. It's valuable for guiding procedures like biopsies and radiation therapy, and for monitoring the effectiveness of cancer treatments. If a patient presents with symptoms like unexplained pain, dizziness, or signs of a stroke, a CT scan of the head can rapidly identify issues like bleeding or blockages in the brain. It's also commonly used to evaluate conditions affecting the chest, abdomen, and pelvis, providing detailed views of organs like the lungs, liver, kidneys, and intestines. Why is a CT scan often the preferred imaging technique? This brings us to why a CT scan is often the preferred imaging technique in certain scenarios, particularly in emergencies or for specific diagnoses. One of the primary advantages of CT scanning is its speed. A complete scan can often be performed in just a few minutes, and in some cases, mere seconds. This is crucial in emergency settings where time is of the essence, for example, in assessing stroke patients or individuals with major trauma. CT scans also provide excellent detail of bony structures and are very good at detecting acute bleeding, making them superior to MRI in some urgent situations. Furthermore, CT is less sensitive to patient motion than MRI, which is beneficial when imaging patients who are uncooperative or in pain. While MRI excels in soft tissue contrast, CT provides a rapid and comprehensive overview, making it highly effective for a wide range of diagnostic challenges, from identifying kidney stones to evaluating complex fractures or detecting lung diseases. Who operates CT devices and interprets the resulting scans? Understanding who is involved in the CT scanning process is also key. The actual operation of the CT scanner is performed by highly trained professionals called CT technologists or radiographers. These technologists are responsible for preparing and positioning the patient for the scan, ensuring their safety and comfort, selecting the appropriate scanning protocols as determined by a radiologist, and operating the sophisticated CT equipment. They also administer contrast material if it's required for the scan. Once the images are acquired, they are then reviewed and interpreted by a radiologist. A radiologist is a medical doctor with specialized training in diagnosing diseases and injuries by interpreting medical images, including CT scans. The radiologist analyzes the images, identifies any abnormalities, and prepares a detailed report that is sent to the patient's referring physician, who will then discuss the results and any necessary treatment with the patient. CT scan safety, understanding radiation exposure. A very important consideration with CT scans is CT scan safety, understanding radiation exposure. It's true that CT scans use ionizing radiation, which, at high doses, can increase the risk of cancer. However, the medical community is highly aware of this, and modern CT scanners are designed to use the lowest possible radiation dose, a principle known as ALARA, as low as reasonably achievable, while still obtaining high-quality diagnostic images. Radiologists and technologists are trained to tailor the radiation dose based on the individual patient's size, the body part being scanned, and the specific clinical question. The benefit of an accurate diagnosis from a medically necessary CT scan almost always outweighs the potential risk from the relatively small amount of radiation exposure. Patients should always discuss any concerns they have about radiation with their doctor, who can explain the risks and benefits as they pertain to their specific medical situation. Preparing for your CT scan. Key steps for patients. If a CT scan is in your future, knowing how to prepare is helpful. So, what are the preparing for your CT scan? Key steps for patients. Preparation varies depending on the type of CT scan being performed. For some scans, especially of the abdomen and pelvis, you may be asked to not eat or drink for a few hours beforehand. You'll likely be asked to remove any metal objects such as jewelry, eyeglasses, dentures, and hairpins, as metal can interfere with the image quality. You might need to change into a hospital gown. If your scan requires an intravenous 4 contrast agent to highlight blood vessels or organs, a small 4 line will be placed in your arm or hand. You might also be given an oral contrast agent to drink, which helps to outline the digestive tract. It's crucial to inform your doctor and the CT technologist if you have any allergies, especially to contrast material or iodine, or if you have any serious medical conditions, such as kidney disease, and if there's any possibility you might be pregnant. The CT scan experience. What happens during the procedure? Let's walk through the CT scan experience. What happens during the procedure? After any necessary preparation, the technologist will help you lie down on the CT scanner's table, usually flat on your back, though other positions are sometimes used. The table will then slowly slide into the center of the large, donut-shaped gantry. The X-ray tube and detectors will rotate around you inside this gantry, but you won't feel them moving. The machine might make soft whirring or clicking sounds as it operates. It's very important to remain as still as possible during the scan, as movement can cause blurring of the images. The technologist might ask you to hold your breath for short periods during certain parts of the scan. While the technologist will be in a separate control room, they can see you through a window and communicate with you via an intercom system at all times. A typical CT scan is quite quick, often lasting only a few minutes for the actual scanning, though the entire process, including setup, might take longer. CT scans with contrast, enhancing the view. Finally, many people ask about CT scans with contrast, enhancing the view. Often, to get the clearest possible images of certain structures or to detect specific abnormalities, a special dye called a contrast agent, or contrast medium, is used. This substance helps to highlight blood vessels, organs, and other tissues, making them more visible on the CT images. Depending on the area being examined, the contrast can be administered in a few ways. Orally, you drink it; intravenously, injected into a vein, usually in your arm, or sometimes rectally. When 4-contrast is injected, you might feel a warm sensation throughout your body or a metallic taste in your mouth. These are common side effects and usually pass quickly. Contrast agents significantly improve the diagnostic capabilities of CT scans for many conditions, such as identifying inflammation, infection, tumors, and vascular problems, by making different tissues stand out more distinctly from one another. And there you have it, a comprehensive look inside the world of computed tomography. I hope this has helped you understand the power and purpose of the CT device. It's a remarkable piece of technology that plays a crucial role in diagnosing and managing a wide array of medical conditions quickly and efficiently. If you found this exploration valuable, please give it a thumbs up, subscribe to Life of Medical EN, and ring that notification bell for more medical insights. Stay curious, stay healthy, and join us next time.